Joining us now is Dr. Robert Murphy. He's a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Good morning.
Let me ask you about the Pfizer story that we had that said Walgreens was scheduling people 4 weeks out instead of 3 weeks out. If you were one of the people that got it 4 weeks out, is there going to be an issue for you?
No, not at all. These vaccines work kind of no matter when you give them, 3 or 4 or even more weeks out. The way that Pfizer did the study was 3 weeks. And so that's the guideline. That's in their emergency use authorization package with the FDA. That's what the CDC recommends. That's how they did the study. But if you get it an extra week, even an extra month, even longer, it will still work. But your optimal protection will still be 2 weeks after that second dose.
Gotcha. There was talk initially, or way back when, that blood type might affect your risk of getting COVID, but there's a new study says that's not true.
Yeah, no, Robin, this is very interesting. We've talked about it several times, many months ago when these first reports came out. And basically, what this is showing, now that some really tight, very good studies out of Johns Hopkins and another group in Utah and another group in Denmark have looked at it much more closely, correlation does not mean causation. In other words, the first couple of studies, yeah, it was correlated that blood type A did worse. But when you actually look very hard at a group of people, they don't see any correlation at all.
All right, let's get to some viewer questions. Now that Pfizer has shown effectiveness among 12 to 16-year-olds, when will they apply for FDA approval? I keep hearing soon, but also hear statements like adolescents should be able to get vaccinated before going back to school in the fall. Any insight?
Yeah, no, I don't have any personal insight, but they have to file the emergency use authorization application. That means they have to take all that data that they gathered. They've reported the preliminary results, which look very encouraging, by the way. But they've got to get all that paperwork together, and they have to close the database, clean the database, get everything all prepared and submitted to the FDA. So that's ongoing, I'm sure, as we speak. I mean, they want it approved as well. Everybody wants this approved. So, you know, unfortunately, there's no hard answer. It's going to be weeks to months.
Can I ask a follow-up to that? There are many adults who may have been hesitant to get a vaccine, and they go on and do it, and they may be even more skeptical about vaccines for their kids. And I know we don't know much about this one, but in general, do kids react differently, short-term or long-term, to getting a vaccine?
Well, I mean, let's put the whole thing into perspective. Who takes most of the vaccines in the world? It's children. It prevents all these childhood illnesses. So children are very commonly getting vaccines, not so much the adults. I mean, we get Shingrix, we get the flu shot every year and so forth, but kids get a lot of vaccines. You know, and limiting vaccine use in an adolescent, you know, I mean, I guess, you know, the parent, you know, they're the guardian, and they're going to control that. No one is going to force them to vaccinate their adolescent kids. But the kids that, what will happen, I think, is that those kids that are not vaccinated, say in 3 or 6 months after the school starts, their activities actually may be limited.
All right, next question. Reports are constantly stating that children don't transmit COVID, yet children are not regularly tested and may be symptomatic. What evidence is this theory based on?
No. Children don't transmit COVID. There's no doubt about that. But the thing is, they don't transmit it as efficiently as we thought. We thought that the kids were maybe the ones spreading it in the community or whatever. They're not. They don't transmit it as much. I don't really know why. Particularly to adults, they don't transmit it. It may be the difference actually in the physical size and how far away they are. Adults transmit it very efficiently to each other. But kids do transmit, but not efficiently.
All right. Next question. My 3 adult sons received the Johnson & Johnson vaccine. The CDC says it is fully effective after 14 days. Other sites say 28 days before it's fully effective. Can you shed some light on which one is true?
Yeah, no, they're kind of both true. The guideline is that 14 days after your vaccine, you have enough immunity to get out there and you're protected, basically. Now, in the study that Johnson & Johnson did, although the immunity increased very much at day 14, it continued to increase even more at day 28. So the maximum effect was after 14 days, but you have a very good effect at 14 days, and that's the formal recommendation.
All right, Dr. Murphy, thanks again for being with us. If you have a question for the doctor, you can post it on our Morning News Facebook page, and we'll see if we can ask him that question, and we'll be talking to him again tomorrow at this time. Thanks a bunch.
Thank you, Doctor.